I'm Shannon Edwards, and I will be placing a saphenous intravenous catheter on this dog. I will start out by clipping up the leg and cleaning it. I have previously washed my hands before I started doing this, as well as having watched the instructional video. So right now I'm just preparing for the placement of the intravenous catheter, which I'll start by just clipping hair over a wide area around the insertion site of the cephalic vein. And then after that is sufficiently clipped, I will prepare it as if I was preparing for a surgery site, whereas I would use a surgical scrub in solution and clean it really well. Right now I'm just making sure that all of the area that needs to be shaved is adequately shaved. And now here I am just wiping all of the excess hair off, and I'm gonna grab chlorhexidine scrub and just scrub that really well to make sure it's very good and clean, so we can keep the area as sterile as possible. So right then I was just doing the initial clean, and then I take an alcohol pad and just wipe up the excess. So I'm going to take more chlorhexidine scrub, and this is the part where I'm actually going to do it in a sterile way. And then I will take an alcohol swab and wipe that excess away. Now I'm going to get my holder to hand me a paper towel just to dry up the excess moisture that's there. Making sure not to touch where I'm actually going to insert the catheter into, so that it remains sterile. Don't mind me where I try to adjust where you can actually see what I'm doing. Right here I'm just checking my catheter to make sure that the tip is not burred, make sure there's no flaws. I'm going to go ahead and flush the catheter. And I have already prepared my tape that I will need ahead of time. I want to pull out the leg and ask my restrainer to distend the vein. I'll look down and make sure that my bevel is up while I try to insert it. I did start having trouble with the catheter at this point, so I did end up having to grab another one and restart, which is why that was that little cut off right there. I do apologize because I just noticed that you can't really see me inserting it. But I had once again inserted the catheter into the vein with the needle bevel up. I inserted the needle into the vein at least half an inch before slowly advancing only the catheter after I got a flash. I think I had to grab my tape right here because when we first started we had started on the opposite leg, so it was still a little further over. So I'm grabbing my catheter hub while I have my holder just hold the catheter in place. I'm placing a piece of paper towel under the catheter just to keep blood from going everywhere. As you can see, I was struggling trying to get the end of that catheter off. And I just keep putting my butt in your way. I apologize for that. So I placed the hub. Or place the injection cap rather. And then here I am placing the first piece of tape with the sticky side down under the catheter cap. And I will encircle the leg at least one time. That way the catheter hub is secured onto the leg. I was trying to tear the tape at that point, and it took me a minute. I think I end up grabbing scissors. Or I just went ahead and wrapped the rest of the tape, it looks like. And then I'm going to grab my second piece of tape, which I did not think about at the time, but it says you were supposed to flush the catheter before applying the second piece of tape. Which I'm now doing out of the order that it's supposed to be. And I'm just going to feel to make sure that the catheter is in, which I'm trying to show you, but my phone is at a weird angle. Thank you, Kinley, for fixing that. So right here, I'm just flushing it to make sure that it is in. Now I'm just going to clean up the catheter side of any blood. With some, pretty sure it's alcohol on a sponge or something. And then I will take my last piece of tape. I'm now taking my last piece of tape under the catheter injection cap. To ensure that it will not slip out. And then after I do this, I will just note in the patient's medical record the date and time that I placed the catheter. And she was a really good girl for this. I finally had to get scissors to cut tape. I do apologize that it's so quiet. I had to mute the audio because there was a lot going on and there was a lot of noise. So I was just going to do a voiceover. So thank you. And there is my cephalic IV. Saphenous, not cephalic. I apologize. My saphenous intravenous catheter. And I'm once again just flushing it to make sure that it is still in.